So in Foxboro, we currently have 77 cases of COVID-19 since that occurred since March 15th. 47 has since recovered. 22 people are currently positive that are active at this point in time. 5 cases have been lost during the contact phase. 386 people have tested negative in Foxboro. A total of 3 people are hospitalized at the current time. One person increased over yesterday, so that's a new trend upward in that respect. Hopefully, it doesn't stay that way. One person has since passed away as a result of COVID-19 cases. In terms of Massachusetts, on a statewide level, there were 60,265 cases in Massachusetts. 15,799 cases in Middlesex County, which leads the state in terms of cases. Suffolk County is right behind it with 12,539 cases, and there are 5,700 cases in Norfolk County as we speak. 484 cases of those 484 individuals have passed away as a result of COVID-19 complications in Massachusetts, or in Norfolk County rather, at this time. 18,300 people have, 18,300 COVID-suitable beds are available. 3,803 COVID patients are occupying those beds, and 1,001 COVID ICU patients currently exist at this time, and which is a trend downward, by the way, which is good to see that. Hopefully that trend continues statewide level. All right, so let's take a look at what's happening on the report. So, just a couple things I wanted to talk about at this point in time. First of all, the past few nights I've been spending time working on the budget with both the Board of Selectmen and the Advisory Committee. I made presentations along with the Finance Director at both meetings to give an indication that we are currently that we've had to make some trims to the budget, and actually some significant reductions in the budget as a result of what we anticipate to be reduced revenues and state aid that will be coming in for next fiscal year. They since have taken an actions to trim the budget by $2.6 million over what was planned to be spent for next year, and also cut into some of the spending that's occurring this year as well. So as a result, the budget is up overall, but it's still up minimally compared to other years. The good news is that we've not had to trim services per se, but we have trimmed our spending in terms of capital plans. We've cut that by $875,000. We've actually reduced. We're going to hold off a year on our OPEB payment, and that's directly related to the fact that we are not seeing the revenue come in on the hotel, motel, and meals tax, which is the primary source of funding for that particular expenditure. We hope to be able to resume that later this year, and if the revenues start to come in, we will certainly put money towards that expense and to get us back on track. If not, we'll we'll try and double up in the next years in a few years coming forward to get us back on track for that expense. We're very proud of the fact that we've been able to keep that OPEB payment coming, and looking to try and eliminate that expense in the middle to early 2030 time frame. 2035 rather time frame in that range. So the other thing I wanted to just make people aware is that the town meeting is scheduled for June 15th. And also, more importantly, the election is scheduled for June 8th. Now, the town clerk advises, and you should all be aware that voting, absentee voting, is actually a preferred way to vote. This obviously under these conditions. You can go to our website, and you'll be directed to more information on how you can do that. Obviously, voting at the polls is going to be a little bit more complicated than it normally is. But if you can actually vote through the absentee ballot process, which again is fully described on our website, go to the website and try and follow up on that and see if that can help us get through the election process safely for everyone, and make sure that we get that process completed, as it is very important to the community overall. So let's take a look at the major update from the Board of Health. The Board of Health, this is for obviously for Thursday, April 30th, the last day of April. The Board of Health received several updates from the state this week. Links to the most current information and resources may be found at foxboro.ma.gov/department/health/COVID-19-health. The state has launched the Community Tracing Collaboratives, the CTC, not to be confused with CDC, which is an important part of the state's strategy to fight COVID-19. Through the collaborative, people who have been in contact with a COVID-19 positive case may receive a phone call to help track the spread of the disease and provide guidance to the individual. More information is available at foxboro.ma/department/health/COVID-19. And so the President signed an executive order to keep meat and poultry processing facilities open during the COVID-19 national emergency. Processing plants are being declared critical infrastructure under the Defense Production Act for the duration of the coronavirus outbreak to prevent further shortages in the food supply. Companies in the meat and poultry industries have experienced temporary closures due to COVID-19 outbreaks amongst the staff. Closures cut pork production by as much as 25% and beef production by as much as 10%. The order follows the release of joint guidance issued by Centers of Disease Control and Prevention and the Occupational Safety and Health Administration, otherwise known as OSHA. Under the DPA, the meat packing facilities should be able to receive more tests and protection gear, and the USDA will work with meat processors to confirm they are operating in accordance with the CDC and OSHA guidelines. From the MRC email, we can give you some updates on that. Obviously, it pointed out that 60,265 confirmed cases of COVID-19 have occurred in the Commonwealth since yesterday at 4 o'clock, with 1,963 new cases and 3,405 deaths as a total based on the 4 o'clock statistics that came in. The 1963 new cases is actually a trend in the wrong direction. It was actually down at around 1,500 at one point. Now we've since reduced that. That seems to be an increase over the past few days. Let's hope that that does not continue in that direction and we start going back the other way. Overall, over 254,000 tests have been conducted by public and private sources. The Department of Public Health has regularly released a daily reporting dashboard containing detailed information on hospitalizations, demographic data, and county-by-county breakdowns of the cases. The Department of Public Health has released COVID-19 confirmed positive cases by municipality each week. Three of our four communities report numbers. 3 of the 4 communities from the MRC report numbers below the statewide infection rate of 0.86%. Under healthcare, hospital capacity as of April 28th, 53% of the Commonwealth's 18,300 permanent beds, temporary beds are available for new patients if needed. Personal protective equipment, PPE distribution continues across the Commonwealth. It was interesting to note this morning on the national news that the state of Florida currently has over 3,000 extra ventilators that they're not using currently because their numbers have not gone as high as first anticipated. So we may see some redistribution of that equipment to other states, in those states that need it the most. Let's hope that we don't have to continue to have a need here in the coming weeks. This governor has obviously declared that the stay-at-home advisory, or stay-at-home directive rather, is actually in place until May 18th rather, and we should hope to see that starts to ease after that. Let's hope that cases start to continue trending in the right direction. Here in Foxboro, we're actually working on a reopening plan. We've been working with the Board of Health along with several of the town departments to come up with a plan that we think will work and keep people safe and keep the employees safe while we'll be able to conduct business in maybe a scaled down version, but certainly in a way that we can get back to work at some level here in Foxboro. Mobile testing, the Massachusetts National Guard Mobile Testing Unit continues to visit and conduct tests at the Commonwealth's long-term care facilities, having made 443 visits and conducted over 20,920 tests as of April 28th. And following yesterday's announcement of the supplementary nursing home funding, the administration released the 28-point infection control list that facilities will need to comply with to receive funding. Facilities must satisfy at least 24 points that can be considered in compliance, and 6 of the control measures are considered core competencies required of all facilities that receive funding. The DPH Nursing Home Family Resource Line has fielded 4,600 calls since launching and is available 7 days a week, 9 a.m. to 5 p.m. Anyone interested in finding out information about nursing home access, etc., can call that number at 617-660-5399. Again, that's 617-660-5399. Let me see. In the education area, the Board of Elementary and Secondary Education voted yesterday to temporarily modify the competency determination requirements for current high school seniors during the COVID-19 emergency. Under this change, seniors who have not passed one or more of the high school MCAS tests will still be able to earn the competency determination through the successful completion of a relevant high school course. And unemployment and worker assistance to assist individuals who may not be sure if they qualify for pandemic unemployment assistance. The Executive Office of Labor and Workforce Development has released a simplified eligibility checklist for individuals to check if they are covered by the PUA. And some of the additional items. April 29th was Denim Day, DENIM Day, which raises awareness of domestic and sexual violence in our communities. If you or someone you know is experiencing or at risk of domestic and sexual violence, please call the State SafeLink resource line at 877-785-2020. You can also call 211 and access the resources through Jane Doe Inc. or RAINN, RAINN, or review the trial court's guidance on obtaining protective orders during the pandemic. And on Thursday, May 30th, at 2 p.m., the Department of Public Health will hold a remote youth town hall for young people to speak to experts and each other about COVID-19 and ways to keep their communities safe. That information, we'll get you more information on that as it becomes available, and how you can access that, and how the youth of our communities can actually access that information. Let me see. As far as the work and unemployment benefits, I think we've provided enough information on that so that people know where to go at this point in time. If anybody needs more information on that, they can go to the state's DUA website and the Department of Unemployment Assistance. They can actually give you that information as necessary. Department of Public Health is hiring up to 1,000 people to do contact tracing. Applicants should be fluent with technology and multilingual. Applicants are encouraged to apply. American Red Cross is asking for blood donations. That call is gone out just about daily, and we want to make sure that everybody's aware of that. So that there is a significant there was a number of blood drives that have been canceled as a result of the COVID-19 epidemic, and so there's a pretty significant need for blood at this point in time. The need is dire due to cancellations of hundreds of blood drives. You can call the 1-800-RED Cross for more information on how you can access that information and to see if you can sign up for a donation. And I think those are the latest information. You can certainly, that's all the latest information I have. Just one last reminder that please consider donating to the Mass COVID-19 Relief Fund to support organizations to provide key safety nets, supports for people in Massachusetts hardest hit by the virus. And just a couple final comments. Again, just want to give thanks to, send out a shout out to all of our employees who have been working so hard during the COVID-19 crisis. A lot of people on the front lines trying to keep the organization going and to keep you all safe in this community. Public safety, and of course many of the support departments have done a terrific job of staying actively involved and working on a day-to-day basis. I know that the Council on Aging and Health and Human Human Services Department have done a terrific job. Board of Health has stayed active. Recreation, all the departments have planning. All the departments have remained active, though some of them maybe not as as pronounced as others in terms of the frontline activity, but certainly they're working pretty hard and diligently in the background. So good to see that. The DPW doing a great job keeping the streets open and protecting us during the water and during and making sure the water runs and the sewer runs and the streets stay safe in that regard. So thanks to everybody. They're doing a really terrific job. And then finally, I just want to say thanks to all of you for continuing to watch and for your updates that you keep sending me on a regular basis. It's great to have this sense of community going on throughout most of this time. It's been great to hear back from people and know that people are genuinely interested in how things are going and reaching out to each other, and that's really great to see that. Again, just another shout out to also to the Eden Foxboro campaign. That's really worked out really well. Glad to see that that's continuing, and there'll be new people announced who are winners for next week. I believe this is the last week of the campaign for now. They may extend it because of the COVID-19 the social distancing guidelines have been extended to May 18th. So let's see if they want to extend that program if that's possible. So haven't heard that yet, but hopefully it'll be the case. And then last but not least, just want to say please stay healthy, stay home if you can, and get out this weekend. It looks like Friday and Saturday are going to be a little bit rainy today, but hopefully by Saturday afternoon it's going to clear off, and Sunday's supposed to be a really great day. Maybe get some yard work done. Feel free to use the composting facility that'll be open again this weekend on Saturday and during the week. And if you need help in getting directions for that, certainly let us know. We'll try to help you with that situation. So that is my update for today. Hope you all stay safe and stay well during the next 24 hours. I'll be back again tomorrow morning with a further update on what's happening in Foxboro. Until then, stay safe, stay healthy. I'll see you next time.